Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, treatment of Wilms tumor. So, treatment of Wilms tumor is first treatment of stage 1 Wilms tumor. In stage 1 Wilms tumor, first we should do a transperitoneal radical nephrectomy is done. We can either do a transperitoneal radical nephrectomy where we remove the kidney, or we can do radical nephroureterectomy where we remove the kidney along with the ureter. And this is followed by a chemotherapy can be done with or without radiotherapy. Depending on the histology, we can do either chemotherapy with or without radiotherapy.
thank you and thank you for watching.